U.S. Ambassador to Uganda, Natalie Brown, led a team comprising health experts to this media briefing where they expressed concern that the Ebola outbreak could lead to socio-economic disruptions if it is not contained as fast as possible.
Per capita GDP in Uganda is currently around $858. So imagine how families will be affected if it's dropped to $733.
According to the experts, Uganda lost about 6 weeks before the country could respond to the Ebola outbreak, and that delay, they say, accounts for the growing cases in the country.
The Ministry of Health teams on the ground now are trying to track back to find who the first patient was, which would give us clues as to where, what they did, or what they came into contact with. I don't know that we're going to succeed in that, but they have been capturing bats and other animals and testing them to see if we can't find this species of Ebola virus in them, and that will tell us what people have to be careful about.
However, it was also noted that medical workers could have confused the reported cases between an Ebola outbreak and malaria, which is highly prevalent in the country. Some of the initial signs and symptoms of malaria present like those of Ebola. The U.S. has since provided 85 billion shillings to help Uganda effectively respond to the Ebola pandemic.
U.S. government funding advances Ebola surveillance and contact tracing, case management, follow-up care for Ebola survivors, diagnostics and laboratories, risk communications and community engagement. In Uganda, there was just a report released by the IGG about the cost of corruption and how people will say leaking or funds don't necessarily make it to where they need to go, and that is a very real and a very serious challenge. And that's also one of the reasons why we work through so many of our other partners instead of just providing direct budgetary support.
The team also visited Kasanda and Mubende districts to establish the response on the ground, and they are satisfied with the progress so far.
In order to end this outbreak, it will take everyone's vigilance and your help. If you or anyone you know is experiencing symptoms that could be associated with Ebola, we urge you, when you have such symptoms, to contact the hotline immediately and seek further guidance.
Uganda has 131 confirmed cases of Ebola, with 40 people admitted in hospital. The death toll stands at 46, while 45 people have recovered. More than 2,000 people have been listed for follow-up as contacts. Walter Mwesije, NTV.